Good evening, ladies and gentlemen. The purpose of the presentation you're going to see tonight is designed to give you the big picture on Obamacare. In order to paint that picture, I have had to use specifics to show you how Obamacare will affect every man, woman, and child in the United States. Health care is dictated by Obamacare. Now, normally when you discuss a subject, the first thing you do is you define it. This is Obamacare. This is a 4-inch binder filled front to back with pages printed on both sides in number 10 font. It takes 2 hands to hold it up. On the other hand, these are our founding documents, the Declaration of Independence and the Constitution of the United States. I can hold these up with 2 fingers. The Declaration of Independence defines human rights. We hold these truths to be self-evident, that all men are created equal, and they are endowed by their Creator with certain unalienable rights. Among these are life, liberty, and the pursuit of happiness. The Constitution gives us a roadmap to guarantee these rights. We, the people of the United States, with emphasis on we, the people. Fact. June 28, 2012, the Supreme Court found Obamacare constitutional. 193-page decision, but they did find Obamacare constitutional. Political cartoonists say it in less words, but the important thing to remember here is this in the window says, buy a new Chevy Volt or pay a $2,000 tax. That, ladies and gentlemen, is now the law of the land. The Supreme Court has made it legal for the government to force you to do something, or they can punitively tax you. Fact. On November 6, 2012, the American people guaranteed the implementation of Obamacare by re-electing Obama. Just what is Obamacare? A bureaucrat's definition will look something like this. And note, the Secretary of Health and Human Services is right in the center. I will try and define the undefinable. Obamacare, Public Law 111-148, has 10 titles, 58 subtitles, 456 sections, and I have not even begun to count the subsections. According to supporters, Obamacare was supposed to solve 2 problems. 1, insure 30 million uninsured Americans. 2, make health care affordable for all Americans. Thus the title, the Patient Protection and Affordable Care Act. How is Obamacare going to be paid for? Taxes and fees. Title IX, revenue provisions. There's 5. There's 5 more. Now there's another 5. Adding 2, we come up with a total of 17 revenue provisions. These 17 revenue provisions contain at least 20 new taxes. Section 9008 through 9010 all begin with the same 4 words: imposition of annual fee. Research and development has always been a very important part of our medical advances. But now we have Section 9009, imposition of annual fee on medical device manufacturers and importers. Medical devices, eyeglasses, hearing aids, braces, hip replacements. And the important thing to remember about this section is the fees are on gross sales, not gross profits. And that is a huge difference. Wilson Greatbatch Recently, Wilson passed away at 92 years of age. But in 1958, he invested $2,000 of his own money. And remember, these are 1958 dollars, not 2013 dollars. Then he went into his backyard, started a garden so he could feed his family while he worked on his invention. He eventually licensed his invention to Medtronic, a company now valued at $36 billion. Obviously, when Wilson passed away, he was a very wealthy man. But I don't think anybody here would begrudge Wilson his wealth, because he gave the world the pacemaker. And how many millions of lives have been saved with the pacemaker? Questions? Isn't the real beneficiary of research and development the patient? Do these fees increase or decrease the cost of medical care? Or maybe a better question would be, will these fees impede the invention of the next pacemaker? Work hard. My parents drilled that into me ever since I was old enough to understand the words. But now, starting this year, Obamacare adds an additional 0.9% to the 2.9% Medicare tax. Singles, $200,000 and above. Couples, $250,000 and above. That is a 31% increase in the Medicare tax. 31%. Save and invest, another truism. For the first time, the Medicare tax applies to investment income, interest, dividends, capital gains, 3.8%. Oh, and these new taxes are not indexed for inflation. We all know that inflation decreases the value of a dollar, so you need a lot more dollars to buy less goods. So as your income rises to keep up with inflation, you will soon fit the definition of the rich due to tax bracket creep. The alternative minimum tax is an excellent example of tax bracket creep. The alternative minimum tax originally applied to 115 households in the whole United States. This year, it will apply to 31 million households. Section 9015, additional hospital insurance tax on high-income taxpayers. Now, ladies and gentlemen, we all know that there's millionaires and billionaires. We all know that they pay a lot of taxes. And there's a lot of people that think they should pay a lot more taxes. But this section doesn't hurt these three guys. This section really hurts the small business person. The reason for that is most small businesses are either sole proprietorship or subchapter S corporations, which simply means any profit or income they make from the business is passed through to the Form 1040, and you pay taxes on it at earned income, which are the highest rates. This profit that will be taxed is in effect operating capital that is used to reinvest in the business, to build and expand. In other words, create jobs. Let's look at an example. Small company employs 18 people. 2012 profits, $250,000. The owners wants to hire 2 new employees in 2013. And they feel with purchasing equipment and all the training, it's going to cost them $100,000. There's no way for the owners to set aside that $100,000. Therefore, the $100,000 is taxed as straight earned income, the highest rate. Federal taxes, 39.6%, $39,600. Medicare tax, 3.8%, $3,800. State of California, 13.3%, $13,300. Total, 56.7%, or $56,700 of that $100,000 needed to employ people goes to the government. Now keep in mind, ladies and gentlemen, that this is just the tax on the $100,000. The owners would have to pay tax on their entire profits, not just the $100,000, but I wanted to show you what happens to that $100,000. Now, as I go through this presentation, you will also notice that I use $100,000 a lot. And it's not because I make $100,000 or anybody in this room makes $100,000. It's just that it makes the math much easier, and by staying with one number, it's easier to follow what is going to happen to your money. Ask yourself this question: where's the money? The FBI asked Willie Sutton when they finally caught him, "Why do you rob banks?" And Willie Sutton said, "Because that's where the money is." So where is the money? Let's say, for the sake of argument, we have 500,000 millionaires and billionaires in this country. I don't think we do. I know at last count we had 416 billionaires. But let's say we do, for the sake of argument. And let's raise their taxes 10%, or $100,000 each. That will raise $50 billion. Now, to you or I, that's a lot of money. But it won't run the government for 1 week. Now let's say, for the sake of argument, we have 100 million middle class. It makes sense. There's 315 million Americans. 100 million is about a third, so that's a reasonable number. And let's raise their taxes by $10,000. You would raise $1 trillion. $1 trillion. The money to pay for Obamacare, ladies and gentlemen, is in the middle class, not in the wealthy, because you could confiscate every penny of the wealth of the billionaires, and it still wouldn't pay off the present national debt. Effect on the average citizen. I've been doing this for a while, and people will come up to me and say, "Tom, this isn't going to affect me. I'll never make 100,000 or 200 or 500. I'll be lucky if I make 50,000. But it will affect you, and here are some of the ways. Fact: effective January 1st of this year, every employer must pay a $63 tax on each employee covered by medical. Reason: to cover unanticipated costs of the no pre-existing condition clause in the Obamacare law. This will build a $23 billion slush fund. The $23 billion will come out of the budget for employees' compensation. Anybody who's owned a business or been involved in the budget process knows that every year you set a certain amount of money for employee compensation. This is what you budget for. And this $23 billion will come out of that employee's compensation because medical insurance is included in that figure. In other words, $23 billion goes to the government instead of the employees. Widow sells her house. She wants to move to be near her children and her grandchildren. Very logical thing to happen. The house shows a profit of $350,000. $250,000 is not subject to capital gain, but $100,000 is. What happens to that $100,000? Capital gains tax was 15%. Effective this year, capital gains is 23.8%. That's an increase of 58.7%. 58.7% is what that tax increased. Federal tax, capital gains, 23.8, 23,800. State of California, 13.3, 13,300. Feds want even more. Medicare tax, 3.8, 3,800. But that's not all. The entire $350,000 will show up on the Form 1040. And the Medicare minimum for Part B in drug coverage is $105 per month per person. But since Medicare benefits are now means tested, the widow will pay an additional $230.80 per month for the follow calendar year for her Medicare benefits. Total for Medicare benefits, $4,030. Grand total, $44,930 comes out of that $100,000. Can the average widow afford these taxes? Fact. Section 9013, modification of itemized deductions for medical expenses. This year, the floor of allowable medical deductions will increase from 7.5% to 10% of the adjusted gross income. For example, if your adjusted gross income is $100,000, last year you had to spend $7,500 before you could deduct 1 penny of your medical expenses. This year, you're going to have to spend $10,000 before you can deduct 1 penny of your medical expenses. That is an increase of 33.3%. 3 taxes. We've discussed 3 taxes so far. Medicare up 31%. Capital gains up 58.7%. Medical deductions up 33.3%. These are significant tax increases. According to the Wall Street Journal, September 28, 2011, and please keep that in mind and date because these figures have increased since then, but we'll use the 2011 figures. Employees' medical insurance premium increase averaged 3% prior to Obamacare. It's averaging 9% after Obamacare. The average annual cost of family coverage for the first time is passing the $15,000 per year mark. That is $1,250 per month. Please keep these figures in mind as we go through the presentation because you see how they will affect you. Section 9002, inclusion of cost of employer-sponsored health coverage on W-2. This is an interesting one. Most Americans receive their health care through their employer. I get very little argument on that. Up to this point, the value of the employee-paid portion of your health care is not reported to the IRS. Starting this year, the amount will be reported on your W-2. There is only one reason to report medical coverage benefit on your W-2, so it can be taxed. Now, I've heard the argument, oh, no, the reason that it's on the W-2 is that when you go to the exchanges, you need your W-2 to prove whether you have employee coverage or not. If that's true, all you need is a box on a W-2 that can be checked. Government acceptable health insurance. They don't need the exact dollar value of your plan. Remember the promise? Social Security will never be taxed. Remember, all taxes are paid with disposable income. Some people call it disposable, some people call it discretionary. But what it is, it's the money left over after you pay your mandatory monthly expenses, like mortgage, car payment, food, clothes, education. These are things we must pay every month. And if your taxes go up, your mortgage does not come down. So we look at an example of a family of 4 living in the Bay Area, taxable income from all sources of $100,000 per year. We've had to figure out what their disposable income was, and we did that by looking at their mandatory spending. And we used charts and averages and graphs to come up with an accurate picture as we could. The way medical insurance costs were handled is the family pays $400 per month, the company pays $800 per month, for a total of $1,200. And the average is $1,250, so we were really close. By just adding the tax on the value of company-provided medical insurance, this is what happens to disposable income. Now, what you're about to see is the summary spreadsheet from all our work. You will notice that up here, everything is exactly the same until we get to the 800 month of the company value, which is $9,600 a year. Keeping in mind, you don't actually get this $9,600. That's the value of a benefit you're already getting. The other thing to notice is that amount increases your income by 9.6%. But because it goes on the very top of your income, you pay the highest rate, it increases your tax burden by 18%. Now, the all-important bottom line. Total discretionary spending prior to that being added was $380. After, $53. That's a loss of disposable income of 86.2%. 86.2% decrease in disposable income. Subtitle F, Shared Responsibility for Health Care. Section 1501, Requirement to Maintain Minimum Essential Coverage. This, ladies and gentlemen, is the penalty or the tax portion. Individual mandate excise tax starting January 2014. This part of the law, ladies and gentlemen, is very complex, it's very complicated, and I could spend 4 hours discussing it and bore you all to tears. So what I'm going to try and do is capsulize it and give you the overall view. And in order to do that, I've had to go to the year 2016. Even though you will start paying the taxes in 2014, 2016 is when it becomes much clearer. Individual income, $100,000 per year. The tax or penalty is 2.5% of the adjusted gross income, or $695, whichever is higher. So that would be $2,500 tax. The average premium in 2012 for a single person is $5,429 per year. Savings by paying the tax and not buying health insurance is $2,925 per year, or 53.9%. Family income, $100,000. 2.5% of adjusted gross income, or $1,390, whichever is higher. We've got the tax of $2,500. We've got a cost for medical insurance average at $15,000 per year. Savings by paying the tax and not buying health insurance is $12,500 a year, or 83.3%. Employers' tax effective 2014. Business owners with more than 50 employees must buy government-acceptable health care coverage or pay a yearly tax of $2,000 per employee if at least one employee receives a tax credit. The operative words are in red: 50 must, government acceptable, and 2,000. The math is unbelievable. If just one employee receives a tax credit, the employer has to pay $2,000 for every single employee he has. An employee with a family of 4 can earn up to $88,200. $88,200 per year and get a tax credit. I know of no company that has a minimum salary of $88,200 a year. Almost all employers will have an employee receiving a tax credit. Magic number of employees. Guess what the magic number of employees is going to be? 49. Because the minute you go to that 50th employee, all of this comes into play. January 1, 2014, no pre-existing conditions. This, ladies and gentlemen, is the linchpin of the whole thing. Let's do a little more math. The average premium for a family is $15,000 per year. 50 employees, tax of $2,000 per employee, it's $100,000 per year. Health care cost at $15,000 is $750,000 per year. Do the math. Simple math. It is cheaper to pay the tax, and then if you get sick, go out and buy an insurance policy. You can literally fill out the application in the ambulance on the way to the hospital, and the insurance companies cannot refuse you. By the same token, once you've gotten better, you can drop the policy and pick it up again when you get sick again. No insurance system in the world can survive under those circumstances. How many employers are going to drop health care? The news is full of stories about companies that are reducing working hours to less than 30 hours per week. Got to get below that 50. This will greatly increase the number of workers using the exchange, and it is probably going to collapse the exchanges. It'll just be too many people. I want to get away, ladies and gentlemen, now from the taxes that are starting this year and are coming in the future, and I want to talk about the money you and I have already spent on Obamacare. In fact, Section 8 of the American Recovery Investment Act of 2009, commonly called the stimulus, appropriated $2.5 billion, which $1.5 billion shall be available for grants for construction, renovation and equipment, and for the acquisition of health information technology systems. In other words, a database in Washington, D.C. Under Section 4002 of Obamacare, the following funds have already been allocated, which means they cannot be stopped. Starting in the fiscal year 2010, $500 million. It works its way up until 2015, where it's $2 billion a year. And it is $2 billion every year thereafter. That's $7 billion and counting. Who controls the money? Good question. Section 4002, subsection C, use of the fund. The Secretary shall transfer amounts in the fund to accounts within the Department of Health and Human Services. In other words, this $7 billion is controlled by the Secretary of HHS. You take that $7 billion, you add the $1.5 billion from the stimulus, you've got $8.5 billion for a database in Washington, D.C. Who is in control? Who is really going to control the medical care in this country? Fact, Section 6301 establishes a patient-centered outcomes research institute. Establishment, there is authorized to be established a nonprofit corporation to be known as the Patient-Centered Outcome Research Institute, which is neither an agency nor establishment of the United States government. Let me read that again. Which is neither an agency nor establishment of the United States government. In Section 9511, the following amounts have already been appropriated for this institute. As of fiscal year 2012, $250 million. Section 3403 creates an independent Medicare advisory board. The job of this board is to control the cost of Medicare. Thus the name Independent Payment and Advisory Board, IPAB. In general, the board shall develop detailed and specific proposals related to the Medicare program in accordance with the succeeding provisions of this section. This section has approximately 6 paragraphs containing a lot of legal language. But the most important sentence is the last one, and it is of the most concern. Any advisory report submitted under this subparagraph shall not be subject to the rules for congressional consideration under subsection D. Shall not be subject to the rules for congressional consideration. Questions? Who is going to hold this institute accountable? Does anyone have any doubt the medical community will have to follow this panel's edicts? Does this mean no oversight, by our elected officials. We have PCORI, Patient-Centered Outcomes Research Institute. We have IPAB, Independent Payment Advisory Board. These initials are nice, but they don't quite have the panache of the English system, which is NICE. National Institute for Health Clinical Excellence. NICE. And the job of NICE is to QAVOL, which is Quality Adjusted Value of Life. And what that simply means, ladies and gentlemen, is when you reach a certain age, and if you need, say, a hip replacement, they're going to look at the cost of the hip replacement, your age, the statistics as to how long you'll live, and decide whether you're worth the money. That's what NICE does. That's what IPAB will do. The Secretary shall. Section after section of Public Law 111148 contains the wording, the Secretary shall. According to the article in the Wall Street Journal, this phrase appears 1,563 times. 1,563 times. So far, there have been 20,000 pages of rules and regulations written on Obamacare. 20,000 pages. And this contains the Declaration of Independence and the Constitution. Estimates are that by the time they get done, if they ever get done, there will be 200 to 300,000 pages of rules and regulations. Who is actually writing the health care laws that will determine care for over 300 million Americans? Could it be? The Department of Health and Human Services submitted a final rulemaking on the state health insurance exchanges that created yet another accounting shell game, one that could force private citizens to pay for coverage of elective abortions. The final rule is 644 pages long. Now, ladies and gentlemen, we're talking about elective abortions. And there's a lot of people in this country who believe that is correct. There is also a whole lot of people in this country that is against their religious beliefs. They feel that this is very incorrect. These rules have the force of law. Therefore, they are going to have no choice. But there is a U.S. Constitution. In Amendment 1, Congress shall make no law respecting establishment of religion or prohibiting the free exercise thereof. Forcing people to pay for an elective abortion or any abortion when it is so much against their religion, they feel that they are being prohibited from practicing their religion. This is an issue that the Supreme Court must bring up, must review, and must decide, and they must do it quickly. To compel a man to furnish funds for the propagation of ideas he disbelieves or abhors is sinful and tyrannical. A quote from Thomas Jefferson, one of our founding fathers. Centralized computer records. Obamacare gives the government everyone's medical records. Everyone's medical records. Your medical records will not be private. The language is not in the law, but it is in the Federal Register that has the force of law. The authority comes from the high-tech legislation regarding electronic health records. Exemption from the Privacy Act of 1974 and HIPAA, which allows release of patient records without consent to other agencies for other activities necessary for the oversight of the health care system. Obamacare also directs the IRS to share confidential personal tax returns with the exchanges and other government agencies. Now, this brings up a very important issue: privacy. Most Americans feel that there are two things that are their business and their business alone: the state of their financial health and the state of their physical health. Yet, all of this information will be in a database in Washington, D.C. that any government clerk can look at any time they want to. And I won't even discuss hackers. Is there a chain of accountability? If so, who is accountable? Internal Revenue Service. It is the IRS who will make sure all taxes are paid. The estimates go from 1,800 to 18,000 new IRS agents will be required to enforce Obamacare. The nation's widely reviled tax collector will also become its health care enforcer. Once the law goes fully into effect, all Americans will have to prove that they have qualified health coverage. And of course, the government will decide what qualified health coverage is. If people don't have coverage and the IRS determines they have the ability to pay for it, the IRS will go after them. The IRS will also determine who is eligible for taxpayer-financed subsidies to purchase health care on the exchanges that will be set up in every state. Keep in mind, ladies and gentlemen, there will be an exchange in every state. Whether it's run by the state or the federal government, there will be an exchange. Anytime anyone's solution changes, a raise, new job, move to another state, that person will be required to report it to the IRS for purposes of recalculating their eligibility. This is not a small group. Obamacare will give tax credits for the purchase of health coverage to the people who make up to four times the poverty level. At the moment, that is $44,100 a year for an individual and $88,200 for a family of four. $88,200 for a family of four. Those millions of Americans had better keep the IRS informed of their status every step of the way. George Orwell's 1984. Has fiction become reality? Ben Stein summed this up excellent. He did in 2 paragraphs, summed it all up. For those of you who can't read this, fathom the hypocrisy of a government that requires every citizen to prove they are insured, but not everyone must prove they are a citizen. And now, any of those who refuse or are unable to prove they are citizens will receive free insurance paid for by those who are forced to buy insurance because they are citizens. Is Obamacare workable? Will it really work? Why have there been over 1,800 waivers to Obamacare so far? Can you remove $716 billion from Medicare to pay for Obamacare? Think about this, ladies and gentlemen. This $716 billion is not a future cut. It's coming out of Medicare right now. This year, it's coming out of Medicare, which will severely damage Medicare. And the irony of all this is that Democrats are showing Granny being rolled off the cliff by Republicans. It's not Republicans that are taking $716 billion out of Medicare. It's the Democrats. Not one Republican voted for Obamacare. Not even Olympia Snow. Medicare Advantage is a tremendously popular program among senior citizens. But Medicare Advantage is gone. It will be phased out in a relatively short period of time, probably 1 to 2 years. No more Medicare Advantage, which means everyone on Medicare Advantage now has got to go out and buy a Medigap insurance policy. They are expensive and they're not that good. Can you penalize investors for making a profit and still get investment in American business? Will many doctors simply retire? Grave concern. I have talked to many doctors since I have been researching Obamacare, and a lot of them tell me, if at all possible, I know what my retirement date is, December 31st, 2013. Because January 1st, 2014, Obamacare goes into effect, and I will not practice medicine under Obamacare. Will young people who are now going into the medical field simply make other choices? It takes a lot more time and a lot more money and a lot more student loans to become a medical professional. We want our best and brightest in medicine, but our best and brightest are going to look at risk, reward, and they may just go someplace else. How will the dictates of Obamacare actually affect businesses big and small? Will it encourage employers to add jobs or eliminate jobs? And we spent quite a bit of time on the math, ladies and gentlemen. Whoever thought they would read articles like this? These are recent articles in the newspapers. The doctor's office, a union shop. As new health care laws turn physicians into service workers, why wouldn't they organize? Nurses are organized. You have nurse strike all the time. Why not doctors? To outsmart Obamacare, go pro-team. Don't fire staff to avoid the 50-employee trigger. Make them corporations. In other words, every corporation, every business possible is going to get below that 50 number. They're going to do it by reducing their employees' hours, less than 30. They're going to fire or lay off people. Or what they're going to do is say, well, let's say, for example, that you run an appliance repair business and you have 100 technicians to go out and repair refrigerators, dishwashers, etc. What you're going to do is take 30 or 40 key people and they're going to work for the company. And then all the technicians who actually do the work, you're going to make them form separate corporations. So they're not your employee, they're a corporation. Think what that's going to do to American business. Some unions grow wary of the health law they backed. Labor unions enthusiastically backed Obama administration's health care overhaul when it was up for debate. Now that the law is rolling out, some are turning sour. And I'm sure a lot of them are looking to 2018 on the tax on their Cadillac plans. Consider the big picture. Again, let's look at the big picture. In the United States, no one is denied health care. The quality of health care is unsurpassed. Now, there will be people that will argue with me on that one, and they'll bring statistics about Sweden and Denmark and so on and so forth. But I base this on two undeniable facts. Number one, people who live in southern Canada and have access to American hospitals, Seattle, Detroit, Buffalo, carry and pay for medical insurance policies in the United States so they can come to the United States for care. Number two, leaders from all over the world come to the United States for medical care. Recently, there was a situation where a leader of a province in Canada flew to Miami for heart surgery. Had to pay for it in Miami. There would have been no charge in Canada. And the leader of a province in Canada is something akin to a governor of a state in the United States. That's a big deal. The problem is not the quality. The problem is the cost. So why Obamacare? Does Obamacare really address the problem of cost? Can anything as complicated as Obamacare really be administered? Can a law written in a language that is confusing lawyers be understood by the average American citizen? Can private insurance still exist when the Department of Health and Human Services is telling them what to put in their policies and what to charge for their policies. Does any reasonable person believe if business finds it cheaper to pay the tax rather than to provide health insurance, they will choose to pay the tax? If this happens, all the employees will be forced on the exchanges. Many, many, many small businesses are wrestling with this right now. Are they better off trying to comply with Obamacare or simply dropping it, paying the tax? Promises made, promises, promises, promises. If you like your coverage, you can keep it. Well, there's only one problem with that. Most American health insurance policies are through their employer. We've discussed that. So what if your employer no longer provides insurances or changes policies? Well, I have a grandfather clause. No, you don't. Because if one thing on that policy changes, just one thing, if the premium goes up $1 or down $1, you lose your grandfather clause. Employer-sponsored insurance has already begun to change. According to the annual Kaiser HRET Employee Health Benefits Survey, the share of workers in high-deductible plans rose to 19% in 2012 from 13% in 2010. That's a 46% increase. One of the law's unintended consequences is that some employers will drop coverage in response to new regulations and the availability of subsidized insurances in the new exchanges. How many is anybody's guess? In 2010, CBO estimated that the number of people under employee-sponsored health insurance would decline in 2019 by 3 million people. That was the estimate for 2019, and that estimate was made in 2010. In 2012, they've doubled the estimate to 6 million people. That's a 100% increase. Lower health care cost. Costs for a typical family would go down to $2,500 a year. Most experts agree the cost has actually gone up by $3,000. That is a $5,500 swing, or 120%. Some insurance companies are pulling out of the market and no longer selling individual policies. Aetna has already pulled out of 2 states. No tax increase on the middle class. I think we've safely debunked that one. A health care law is not a tax. I would like a second opinion. It's a tax. Political cartoonists, they say it all so succinctly. Another part of the big picture, and this is an important part of the big picture. As a society, we will always be faced with a certain percentage of the population that simply cannot handle the day-to-day business of living. As a result, they would probably not handle health insurance properly. Also, there will be a segment of society that simply cannot afford to purchase health care insurance. Now, ladies and gentlemen, we are a very charitable society. The American people give more to charity than any other nation on earth. And any solution to the medical insurance, medical care problem has got to take these people into account, and it will. For example, replace the existing joint federal-state Medicare funding structure with vouchers and/or block grants. Use this money to buy policies for those who can't afford it in the marketplace, and it would be far cheaper than the trillions Obamacare is going to cost. Other possible solutions: concierge physicians, also known as boutique medicine, retainer-based medicine, innovative medical practice design. This type of medical care is starting to take traction. Common characteristics: physicians do not accept any insurance. Care for fewer patients, ranging from 100 to 1,000 patients per doctor per year. The average today is 3,000 to 4,000. The annual fee or retainer is from $100 per year per patient to $25,000 per year per patient. As you can see, there's a very wide range. The advantages are obvious. Your doctor will have the time to give you personal attention you desire. You will have a 24-hour, 7-day-a-week access to your doctor. Very few people have that today. The rate the doctor charges will not be padded to allow for insurance discounts. And let me spend a moment on that. What happens is every insurance company and the government demand sizable discounts. And the administrative cost of insurance and the length of time between the time the service is rendered and they actually receive their money is quite long. These are all costs of doing business. So, for example, if your doctor says $100 per office visit will cover my expenses and give me a reasonable profit, but with all the discounts I got to give and with all the administrative work, I'm going to make my rates $250 and then I'll discount them. So in effect, they pad their rate sheet in order to cover these costs. Ask any medical professional, and if they're honest, they'll tell you that's true. Well, if the doctors aren't accepting insurance, all those costs go away, and you will have much cheaper rates. Disadvantages. Obviously, it's the cost, and which probably will not be tax deductible. Guess what? If you're on Medicare, concierge doctors cannot accept you as a patient, even if you're willing to pay cash. Why? It's a government rule. But wait, it gets better. Once you reach the age 70, and if you're eligible for Social Security, you must take Social Security. You also must take Medicare Part A and B, or you will lose your Social Security. Why? It's a government rule. Think about it. In order for you to go to a doctor of your choice, even if you're willing to pay for it yourself, the doctor can't accept you because you're on Medicare. So in order for you to get off of Medicare, you will lose your Social Security. So you can pay your own doctor. Now, the millionaires and billionaires, this is not an issue to them, but the average American cannot afford to give up their Social Security or their Medicare coverage. What we need are solutions, not more bureaucracy. Eliminate third-party payers. This is key. Almost every expert I talk to, every doctor I talk to, all tell me the same thing. You will not bring down the cost of medical as long as there's third-party payers. Get the government out of it. Get your company out of it. Make medical care between you and your doctor and your insurance company. The doctor and the insurance company have got to understand you are the customer, not the government, not a corporation. The medical insurance policy then belongs to the patient. If the patient changes jobs, there's continuity of insurance. You have continuous coverage. No pre-existing conditions. That takes care of the problem, pre-existing conditions. It also takes care of the problem that if you as a child are covered under your parents' policy, when you reach the age of majority, you go out, you will be able to buy a regular insurance policy at regular rates. No pre-existing conditions. Government does have a role by establishing reasonable regulations on the insurance industry. And you notice the word reasonable is in red. For example, no lifetime limits. We all know that $1 million limit on hospital insurance today is ludicrous. Rates cannot change because of illness. The only reason your policy can be canceled is for non-payment of premiums. It's a simple contract. We agree to pay you so much in premiums, and in turn, you will provide coverage when we need it. It's a simple contract. provide minimum of 3 types of policies. Cadillac plan. Now, some people love the Cadillac plan. They don't want to be bothered. They want to pay their $10 copay and be done with it. Fine. If they're willing to pay for it, provide them with a Cadillac plan. Catastrophic plan, obvious. And plan where patient picks and choose coverages. For example, government insurance mandates that you must have smoke cessation therapy covered in the medical. I'm willing to bet you that 90% of the American people don't smoke. Why should they pay for that? So let the American people, the marketplace, decide what they want. And very quickly, the market will determine the plans needed and the insurance companies will respond. Allow customers to purchase health insurance along state lines. Competition. Competition always brings prices down. Change the federal tax code so that individuals have the same tax advantages of those with employer-based insurance. Right now, we discussed, as of this year, you must spend 10% of your adjusted gross income before you can deduct 1 penny of medical. Corporations can deduct every penny they spend on medical. It should be equal. Citizens should have that same right. Change the tax code to allow for tax-free health savings account. There's no reason in the world, ladies and gentlemen, why we as citizens cannot take a certain percentage of our income, put it in a health savings account, tax-free, not tax-deferred. This allows the patient to build a fund to pay average yearly medical expenses. That will reduce the patient's dependence on insurance, greatly reducing the premiums. A good example of this is your homeowner's policy. Most homeowner policies have a $500 deductible. The next time you talk to your insurance agents to renew your homeowner's policy, ask him what would happen if you went to a $1,000 deductible, $2,000, $5,000, whatever your financial condition will allow. The higher deductible, the rates start dropping, and they drop very quickly. The patient will demand the insurance padding that is in the medical billing be removed, and we've already discussed that. Encourage states to introduce legislation that would limit lawsuit abuse. We all know what malpractice insurance and how much it adds to the cost of medical. We have come to a point in this country, ladies and gentlemen, where medical services can be delivered in 2 different ways. Almost everybody agrees on this. Healthcare controlled by the state or federal government. In other words, single-payer system. Or the American people taking personal responsibility for their own health care. In other words, patient owns and controls their insurance policy. Combined with the use of health savings accounts, makes health care affordable for all Americans. Now the patient is in charge. Ladies and gentlemen, there is a saying as old as time itself. He who pays the piper calls the tune. If the federal government pays, they're going to tell you what you're going to get. If you pay, you are going to determine that. Because individual control equals individual choice. Thank you for your time.